I love talking about what's coming, what is coming, because you're never wrong, you know. You could just kind of guess and project and then not be around when the predictions come out. Okay, there is a journal called Modern Healthcare. Anybody look at this on occasion? Modern Healthcare, and they came up with the top healthcare milestones of the past 40 years. I just looked at the top 10. I just thought this was interesting. And some of us have lived through some of these milestones from the past 40 years. The first one is sequencing of the human genome. And the way this applies to us and genomics now is, you may know, in the past few years, we're now able to have drugs given based on our genetic makeup. Now, when I went to school, we didn't talk about this, but schools of nursing now are starting to integrate talks on genomics and genetics. Pharmacists talk about pharmacogenomics and pharmacogenetics because they are looking at giving medications based on our genetic makeup. So perhaps if two people have breast cancer, we might be getting the same drug, but based on our genetic makeup, it may be a different dose. Or perhaps one drug won't work at all. I'm even thinking in the Sheltie arena, in the canine arena, there are genetic tests that show whether or not the dog should be taking a certain heartworm medication, because it can be fatal. So now there's genetic tests for our pets as well as us. So let's see, when did this happen? This was about 2000 that we started sequencing the human genome. Then MRIs, probably most of us in our lifetime have had an MRI. Anybody have an MRI in here? Okay, this was started actually in 1980 in Scotland, believe it or not. You know, we think everything happens here, we're first, we're the best in the US. No, this happened in Scotland, where they used the first clinically useful image of a patient's internal tissues using MRI imaging in 1980. Refinements over the next 15 years led to the widespread use by the middle 90s. Then the next one is the Patient Care Protection and Affordable Care Act. This was signed into existence by President Barack Obama in 2010. This is the law that requires citizens to have health insurance and bars insurers from denying coverage. Half of the law is devoted to encouraging delivery system reform. So we're doing a lot of things because of this Patient Care Protection and Affordable Care Act. In 1980, that's when the World Health Organization declared that smallpox was eradicated. In June 1981, this is when the CDC reported a cluster of pneumocystis pneumonia in 5 gay men in Los Angeles, while physicians in LA and New York identify an outbreak of a rare skin cancer among gay men. And a July 3rd article in the New York Times carries the headline, "Rare Cancer Seen in 41 Homosexuals." This was in 1981. Another top milestone of the last 40 years, and this is really in order, is HIPAA, the Health Insurance Portability and Accountability Act. We talked about that. Started in 1996 with the update in 2013. And let's see, originally it was for workers and their families when they change or lose their jobs. But now we think of it mostly in terms of protecting patient privacy. Then diagnosis-related groups started in, let's say, 1983. It was started by HCFA, and now that's known as CMS. Then electronic health records, that's number 8 in significance. Now, the article in Modern Healthcare talked about Bush in 2004, and maybe you remember when he said, we're all going to have electronic health records by 2014. Oh, we missed that date. We're getting there, we're getting there. But we actually had electronic health care records before 2004. just not as widespread as they are these days. Then there's telemedicine. It actually probably began with the NASA space program, and it's grown into a booming business. For example, CMS has over 70 HCPCS CPT codes to pay for telehealth services. So that's an issue. How do we pay for it? And then I stopped at 10, thinking of the past, the big milestones, and that was the growth of nurse practitioners. So who works with nurse practitioners in their practice? Okay, a few of you do. They started in probably about 1979. And it started, no, I lied. In 1965, it was the University of Colorado that actually envisioned this idea for the nurse practitioners. And that's who I go see, my nurse practitioner. Okay, here are some trends. We'll talk about this. And if you have any examples or additions to the list, let me know. This is the fun part, I think. Tell me about social media and healthcare. Any examples? I'm sorry, I didn't hear. WebMD, okay. Many of our patients, many of our parents go to WebMD to look at healthcare information. Then, of course, we print it out and then we go to our healthcare provider. Look what I learned. What about this new drug? What about this new procedure? What about this new CAT scan that's in Little Rock? I want one too. Did you see recently, I think it's the Office of the National Coordinator for Health IT is having a contest for an app that will help determine who has Narcan, which reverses opiates and heroin use. What is our world coming to? Yes, a contest. So I guess the idea is, because of the influx of people that are on heroin and taking opiates, it's a nationwide problem, probably even here in Johnson City. I know it's in Nashville area. And it's normal people. It's not, the druggies that you think of that are the unclean people. It's housewives and people that have had orthopedic problems. So now it's so prevalent that the Office of the National Coordinator for Health IT has a contest to develop an app to help find Narcan, which reverses the drugs. That's kind of wild to me. But that's not the only application. Do your hospitals have any kind of social media like Facebook or Twitter? Okay. Now that's probably controlled. Your organizations probably don't want you to be looking at your Facebook during work hours. But do you have a person that's in charge of the social media by any chance? Some organizations do, because you're trying to bond your organization with the community. You're trying to get out information. That could be a way if there was, if there was a problem, maybe some kind of disaster, and you needed to call in help. Maybe you needed to find everybody that had a Jeep in this area. Twitter might be a way to do it. Any other examples of social media in healthcare? Good uses of social media in healthcare?
Well, advertising on like Facebook or Instagram or something.
Okay, advertising for your organization.
And weather updates on our website.
Weather updates on the website, good.
And our office is closed.
Oh, yeah, for when the office is closed. Why is it the patients can't get there, but the patients can get there, but the nurses can't? Can't figure that one out. And being a nurse, I could say that. There are organizations that are rated in their use of social media. Mayo Clinic, mostly in Minnesota, is rated as one of the organizations that make good use of social media. So that's something to think about. So those are things like the web, LinkedIn, Facebook. You have to think of the appropriate use. I remember when Facebook first came out and nurses were accused of, and did, wanted to honor their patient. Their patient may have been in rehab for a long time and they were finally getting out of rehab. They were finally going home. So the nurses were so excited, they would post that patient's picture on Facebook. And then we learned, not a good thing. So after that, the ANA, American Nurses Association, came out with a policy saying that's not a good thing. Keep in mind HIPAA, keep in mind patient privacy. Don't put patients on your Facebook. So now we adhere to that. We've talked briefly about cloud computing. That refers to storage on a server, and you don't really know where the server is. I did one of my events and people were like, well, we provide those servers, so I know where those servers are. Well, they're somewhere. They're physically somewhere. We just don't know where we are. So a lot of our applications we get through the cloud. We don't have to have them installed on our own personal machines. Okay, health exchanges. There was somebody in here, I think she had to leave, from the local health exchange. What is a health exchange? What does that mean? Health exchange.
Well, it's interesting because the definition is changing. There is an entity called a health exchange, and that's where providers will put their patient information into this exchange, and then other providers can, if they have that same patient, can look at that information and see it. So this is a concept that helps people who are not on the same EMRs, to theoretically be able to see that. But the definition is really changing now to get away from these entities to the concept of exchanging health back and forth across different EMRs. And that's becoming really fairly easy to do, and will get easier and easier because the different vendors are now signing on to get onto a platform where, let's say you're on Allscripts, you can exchange information with NextGen and back and forth, and without having the same computer system.
And thank you for that. So right now, as I understand it, like Epic, for example, can share data with other Epic facilities. This is something we could have used in Nashville when we were trying to investigate who had the contaminated steroids. We didn't have that health exchange. Most states have some kind of health exchange, the entity you're talking about. Some states are more successful than others. We had one in Tennessee, in Memphis. That was an early one. We were one of the first states to have a health exchange. Other states, unfortunately for us, have surpassed us now. There's states like Indiana that's held up as a good model for this exchange of data between the various organizations. So that's something we're working toward, and it just means data is moved from one facility to another where the patients seek the care. Then I saw actually at the Tennessee Hymns event last week where Paul attended, there was a pharmacist there, and I asked her if there was such a thing as telepharmacy. And she said that in our very state, the Cherokee Health System in East Tennessee is a telepharmacy. Does anyone know about this at all? Have you heard of this? I hadn't heard of that either. And there's very little you can find out on the web about it, but this was a pharmacist that's telling me that they're using telehealth. Telehealth really means that the patient and the provider are at separate locations. So it could be the nurse and the patient. It could be the physician and the patient. It could be the pharmacist and the patient, the radiologist and the patient. They're at different locations, and there's some kind of telecommunications in between. So the earliest telecommunications could be the advice nurse, ask a nurse. Like Kaiser Permanente started this idea of advice nurses. And then, believe it or not, it was in the psych realm psych patients, behavioral health patients in the 1950s, where we used telehealth as well. That was one of the early applications of telehealth. And it was prevalent for a while because of government funding that helped increase the use of telehealth. Georgia is held up as a state that has good telehealth. And speaking of telehealth, we can communicate with our family. I have a colleague that I teach with who uses Skype. Now that can be a form of telehealth. Anybody use Skype for communications? It's kind of like, it's sort of like FaceTime for any of you who've used FaceTime in the Apple world. But Skype is a product, it's a free product. You can communicate to another person that has a Skype ID. Her mother is 90 years old. Barb lives in Virginia. Her mother lives in New York. And so she can dial in every day, and this is using telehealth concepts, and see her mother on the screen live, hear her, talk to her that way. And so she calls her like every day at the same time. So if it's 11 in the morning and her mom doesn't have her hair combed and she's still in her nightie, then she knows maybe she's not feeling as well, as good that day as another day where she might be up, her bed's made, the computer's in her bedroom, her hair's combed, and she's perky. So here her mom is over 90 and she can stay at home and stay by herself through the use of telehealth. And it's really just kind of a homemade telehealth through the use of Skype. She also has a disabled relative in her family who needs prompting. He does live alone, but in order for him to live alone, they do say, well, you know, I don't remember his name, Daniel, did you eat your lunch today? Daniel, did you walk the dog today? Daniel, did you take the dog out today? So these kinds of interactions can take place, and really they can be called telehealth. There's more sophisticated telehealth. Have you heard of something called a EICU, Electronic Intensive Care Unit? Some of you have. It is a product. I only know of one company that has this product. They're now owned by Philips Corporation. And I didn't bring a picture of it, but the intensive care unit, the on the ground, the in-person one, is staffed with nurses, but when they need that extra help, that extra level of expertise, they call in the people that are at the command center, the telehealth command center. It may be on site, it may be a different place. So you could have a command center that's in India. You know, we could have something on a different time zone in India to help us take care of the patients on the night shift. And through something called Leapfrog, have you heard of Leapfrog? Leapfrog's a group of like 500 plus organizations that say, we are not bringing our employees to your facility unless you have CPOE, that's the first time I heard of computerized provider order entry, and intensivists in the ICUs. So a lot of organizations can't afford to have these high-level, high-paid people physically in the ICU. So what takes the place is this electronic intensive care unit. So you have cameras that can be trained on the patients, but not all the time, just when needed. So somebody, the nurse that's in the location in the hospital may say, I have a question about this patient, I'm worried about the blood pressure going down, let me check with my colleagues in the command center. And then the command center can physically see the patient, can look at the parameters, can see what meds the patient is on, etc. And there's that two-way dialogue. So I would say that would improve healthcare. 3D printing, have you heard about 3D printing? There is a physician at Mayo Clinic that had a heart problem, and they did scans and took pictures of his heart and turned these pictures into an actual model. So the surgeons were able to look at this model and essentially practice the heart surgery on the plastic model before they did surgery on the real life patient. Pretty incredible. And you can buy, I wouldn't buy one, but people can buy machines for maybe like $150. Now that you wouldn't use the $150 one to emulate the patient's heart, but you know, you could use it for creating kids' toy models, who knows. All right, analytics. What does analytics mean? What are analytics? Tell me. Please tell me. Please tell us.
We use analytics all the time. We work for an ACO, we're announced as an ACO, and we have an analytics engine called Truven. So we have lots of patient data information in there, and we use that. For instance, for us in clinical, we have a care manager algorithm that will use that data and pulls information out and reports to us which patients have the highest risk scores. So it calculates risk scores. That kind of thing.
So risk of like deep vein thrombosis, or what kind of risks?
We're outpatient, so it tells us, it gives us like the risk of patients' risk for readmission.
Okay.
Or patients at risk for ambulatory sensitive admission, things like that.
Excellent. That's like a miracle, because, you know, as I mentioned, over time, we were the ones that were putting in the data and we wouldn't get anything out. And finally now we're getting it out. So we can make decisions, we can change workflows, we can contact patients, we can provide better care because of those analytics. So that's kind of a buzzword these days. It's a hot word. It's now included in our latest 2015 definition of nursing informatics. Analytics is in there, where we didn't have it before. So hooray, we finally have information. That's what that refers to. Smart machines could be things like robots. I would imagine that people would say, especially they work for IBM, say that Watson is a smart machine. They're trying to portray that as being artificial intelligence. I don't think we're there yet. To me, artificial intelligence means that machine thinks. They don't think. They just utilize the data that's been fed to them over time and can go through it really fast. But they're not at the point where they're replacing us. We're not replaced. One of my colleagues says, a few years ago, said that we were going to be replaced with a PDA and a robot. We can tell how old that is. We don't say PDA anymore. Personal display of affection? No, the other one. The other one. So we're not yet replaced. I don't think that's going to happen. I think we are always needed to hold hands, to care, to cure, hopefully. All right, somebody must know what population health is, population health management. You girls, tell us. Oh.
We use the analytics that we get to figure out to determine which patient's disease process is the highest problematic disease for us. So with our analytics data, we can pull and say, like, one of our focuses is hypertension. So we can pull every patient with hypertension. Of course, that's a lot of patients. So we can prioritize what education we want to do with the patients that are at high risk. Is hypertension, is diabetes, COPD,
Obesity.
kind of an overall disease management program.
Okay. And your diseases might be a little bit different than Nashville, might be a little bit different than Memphis or New York City. That's why we need the analytics to tell us which are the cases. Now, have I missed anything on this list? Is anything hot that you know of that's coming?
We don't have MAPRA on that list.
On purpose? You know, I had it on another page and I took it down because I saw someone after the macro presentation at our Tennessee Hymns event, and they're like, 45 minutes on this topic alone, and it was like over their head, I think. Aren't we still trying to figure out what macro is?
We'll know November 1st.
November 1st, that's right around the corner. Okay, I am remiss in not putting that on the list. What the heck is macro? It sounds like quilting and crocheting and macra.
It stands for Medicare.
Something.
Children with health,
So we will have to understand that, so we know how our facilities are being paid, so we know what the hot buttons are, so we know what the priorities are.
This is provider, physician, and nurse practitioners, so it's outside of the hospital perspective. Affecting doctors in their office.
So value-based payment means there has to be some value to the patient, instead of just paying for things we do, like we used to. We used to pay, you know, you did so many procedures. And
Fee service to value-based payment. Doesn't matter how many you do now, it's your patient outcome.
so this is going to shake us all up. What about November 8th? We have an election.
Too late. It can always be repealed, but it's not likely that that's going to happen. Because even the Republicans like it.
All right, so that's a good catch. What else should we be talking about on where we're headed with healthcare and healthcare IT?
Paul, what's the name of that software system that we're looking at to let us know when the patient hits ED or?
And it lets us know what about the patient?
The minute they hit the emergency room door. So we can do some real-time interventions. And
Be-
it also shares with the providers their PCP, you know, if they're in the ED, we can send alerts to the provider, that kind of thing. They'll be alerting us or manage the patients.
And my stepdad's name is going to be on that because he's the kind, he's like works in the repairing grain elevators. So he's climbing, and every time my mom calls, which is rare, it's like, what happened to Will? Did Will get hurt? And he's the kind that will like get, you know, some injury and sit on it for a couple days and then has to appear at the ER on the weekend. And I'm trying to tell him, no, nobody likes that. Not a good thing. Don't do that. That's not the purpose of an ER. Okay, those are good things. That's all I have to say, believe it or not. Any closing comments? Thank you for being here. Thank you for participating. Good luck. I gave you a lot of potential homework. You can decide whether or not you want to do it. You know, my last slide is there's no such thing as a free lunch. So even though you got lunch today, I think there's plenty to think about, learning about this MACRA, trying to figure out your workflows, trying to figure out who's going to help the IT people improve the systems you have already. What would you like to say?
Well, I would like to thank you so much for coming today. Let's give a round of appreciation for Susan coming today. Susan, I felt like I was reliving my past as you went through that implementation phase. But everything she said is very true. There's a lot on the horizon for us with electronic health records. And what we tried to do today was to give you all exposure to, you know, what the electronic health records are, what are the trends in health exchange, because to improve the care of our patients, we know we're in the electronic world, we have to use it, but we have to leverage what we have and make the best of it. So that's what our group is interested in doing. If you are interested in participating in our community collaborative, please see Michelle, who's sitting over here, or stop at the desk and give your name and we'll just get your contact information. And we'd love to have you be a part of this effort to try to do a better job of sharing this electronic information we have with all the different facilities, regardless of what EMR or non-EMR you're on. We want to be able to get that information out. So once again, thank you, Susan. Hope you all enjoyed the day and benefited from it.